Welcome to the AHIMA CCS-P exam prep course. And congratulations on taking this massive step toward advancing your healthcare career. Earning your Certified Coding Specialist Physician-based credential is a powerful way to prove your expertise in outpatient coding. And it opens the door to incredible professional opportunities. This certification shows employers that you understand the complex rules of physician-based medical coding, which is a highly valued skill in today's healthcare industry. Throughout this journey together, my goal is to guide you step by step, turning complicated concepts into simple ideas that you can actually use. You are going to learn exactly how to approach the exam with confidence, and how to apply these skills in real-world clinics and doctor offices. To get the absolute most out of our time together, I want you to treat this course like a real classroom. That means grabbing a notebook right now, taking active notes, and committing to a consistent study schedule. One of the biggest mistakes students make is trying to cram everything into one weekend. Instead, I highly encourage you to study a little bit every single day. This helps your brain naturally absorb the complex coding guidelines we will cover. Remember that learning to code is like learning a new language. It requires patience and repetition. By completing every single lecture in this course, you will slowly build the mental muscle memory needed to read medical charts quickly and pass your exam. We will begin our journey by building a rock-solid foundation in physician-based documentation. In our first section, you will learn how to read patient health records like a detective. We will explore medical terminology and human anatomy, because you cannot code what you do not understand. A common trap for beginners is rushing through these basics to get to the coding manuals. But trust me, knowing how to extract the right clinical information from provider notes is the secret to accurate code assignment. On the exam, you will need to quickly spot the most important details in a patient chart. And this foundational knowledge is exactly what will help you do that without wasting valuable time. Next, we will dive straight into the world of diagnostic coding using the ICD-10CM classification system. Here, you will master the official coding guidelines that are specifically built for outpatient and physician office settings. We are going to spend a lot of time on sequencing rules, because putting codes in the wrong order is a very common reason for failing exam questions. You will also learn how to capture the true medical necessity of a patient visit by correctly coding signs and symptoms. In the real world, medical necessity is what proves to insurance companies why a procedure was performed. So understanding this concept is absolutely critical for both your certification and your future job. Once you understand diagnoses, we will move on to procedure and service coding using the CPT and HCPCS Level 2 code sets. Navigating the Captain Manual can feel overwhelming at first, but I will show you how to move through it quickly and effectively. Time management is one of your biggest challenges on the CCS-P exam. So learning how to find codes efficiently is a massive advantage. We will also break down evaluation and management coding, which is something you will use every single day in a physician practice. I will teach you how to look for the key components in a doctor note, so you never have to guess when selecting an E&M level. As we move through these core topics, I want to remind you that this course includes multiple practice tests. I strongly encourage you to take these practice tests after completing each section. Testing yourself is the absolute best way to identify your weak areas before the actual exam. But here is an important study tip. Do not just look at your final score. I want you to carefully read the explanations for every single question, especially the ones you got wrong. Reviewing why an answer is correct helps improve your long-term retention. And it trains your brain to recognize the tricky wording that AHIMA often uses on their certification exams. After you master the basics of Captain, we will tackle advanced procedural coding and the application of modifiers. Modifiers are essentially two-digit codes that tell a story to the insurance company, explaining that a service was altered in some specific way. Applying the wrong modifier can lead to compliance errors and lost revenue in a real clinic. You will learn the strict rules for using these modifiers on complex surgical packages and multiple procedures. We will also explore the National Correct Coding Initiative, which is a system designed to prevent unbundling. Understanding these advanced rules will keep you out of legal trouble in your career, and will easily save you points on the exam. Understanding the clinical side of coding is only half the battle, because healthcare is also a heavily regulated business. That is why we will dedicate a full section to regulatory compliance and reimbursement methodologies. You will learn the strict legal differences between fraud and abuse, which is a very popular topic on the certification test. We will also cover HCPCS privacy regulations, because protecting patient data is your legal responsibility as a coding professional. Beyond compliance, you will learn how physician fee schedules and relative value units directly impact financial reimbursement. Knowing how your codes translate into actual dollars makes you an incredibly valuable asset to any doctor or hospital you work for. In our final core section, we will focus on maintaining data integrity and mastering the provider query process. Medical documentation is not always perfect, and doctors sometimes leave out important details. A huge part of your job is knowing how to identify missing clinical indicators, and learning how to communicate professionally with physicians to get clarity. I will teach you exactly when it is appropriate to ask the doctor for more information, and when you should just code based on what is already written. Never assume or guess a diagnosis, because ethical coding standards require us to only report what is clearly documented in the medical record. As we approach the end of the course, our focus will shift entirely to exam readiness and test-taking strategies. The CCS-P exam is challenging, and it requires more than just memorizing guidelines. You need a solid strategy to manage your time and reduce test anxiety. I will share my best tips on how to eliminate incorrect multiple-choice options quickly, and how to highlight key terms in your coding manuals so they stand out during the test. One of the best strategies is learning how to read the actual question before you read the long patient scenario, which allows you to know exactly what clinical clues to look for as you read. I want to remind you once again how important it is to complete this entire course. Do not skip sections even if you think you already know the material. Every single module is packed with specific exam tips and real-world scenarios that build upon each other. Keep pushing forward. Stay consistent with your study schedule, and do not be afraid to re-watch lessons if a concept feels confusing the first time. Repetition is your best friend when studying medical coding. Make sure you complete all the practice tests. Review your mistakes. And trust the learning process. You have the ability to master this material. You just need to put in the focused effort. Welcome once again to the course. I am absolutely thrilled to be your instructor on this journey. Earning your CCS-P credential will take hard work. But the reward of a stable and respected career is completely worth it. When you are ready, I want you to jump right into Section 1 and begin building your foundation in physician-based documentation. Remember to take notes. Utilize the attached practice tests as you go. And celebrate your small victories along the way. Believe in yourself. Stay motivated. And let us get you completely prepared to pass your AHIMA certification exam with total confidence. I will see you in the very first lesson.